So, awesome. Thank you, Amanda. So good to be here. Thank you all for coming. So excited to be with you, Dr. McCullough. I know for me, the first time that I saw you was Joe Rogan in 2021, and I'm sure that was a bit of a life-changing scenario podcast for you at the time. Coming from the medical community, I'm sure yourself. Kind of what has life been like kind of since that time period? And it feels like an eternity ago. That was 2021. COVID hit in 2020. So what's life been like to you and leading up to the publication of your book so far?
Well, thanks so much for the invitation, and thanks to each and every one of you for attending and following us online. I think for all of us, the pandemic has been a period of time of which we won't forget, because it's influenced really the arc of our lives. And some people tremendously, sadly, some people lost their lives through the pandemic. But, prior to this period of controversy that we've entered, I was a professor of medicine. I had a wonderful life. I led large studies, large clinical trials. I became widely recognized in my field. I'd been here in Washington many times because I was on data safety monitoring boards for the FDA. I was on advisory committees for the National Institutes of Health. And when the pandemic broke out, quickly I started to see things happening that didn't make sense. The first thing I saw is people not being treated adequately, and then they were winding up in the hospital. And we quickly learned, once in the hospital, that's where all the deaths occurred.
Exactly. And I want to talk a little bit first about your book, Vaccines, Mythology, Ideology, and Reality. And when I was reading this, I was kind of thinking to myself, this is, vaccines for dummies is how I felt. 186 pages explaining really the history of vaccinations. You and John Leake did such an amazing job writing it, simplified it for someone like me who really doesn't have a background in medicine. Vaccines very complicated. We saw that trying to be explained to the American public and even to the President of the United States, who doesn't have a medical background at that time. Why did you feel like this book was so crucial? And why do you think readers should read this book?
Well, I want to recognize John Leake. He's in the front row here. John, probably raise your hand and say hi to everyone. John is a historian. He's a historian, and when we linked up in Dallas and we saw what was happening, we had concluded that the madness around vaccines that overtook our country, overtook the world, that it must have had some form of historical pretext. It couldn't have just come out of nowhere. And so we applied our scholarship to investigate, how did this happen? How did we get up to a point where if we didn't take a vaccine, we would lose our civil liberties, lose our freedoms?
Great. Absolutely. And, I'm going to jump around here than what I was even thinking. With the pandemic response, I think a lot of people after the vaccinations and during, the process of vaccinations being rolled out, what you've really shot for is the aspect of natural immunity, multiple things that you can take. Joe Rogan, of course, was a big portion of that. And you guys talked about that a lot on the podcast at the time. Robert Malone being another one that he had on, very controversial. And, what is that experience that was like for you with the censorship at the time? I know you said you had YouTube videos being taken down at the time. A lot of this having to do now with the conversation of big pharma that's being tackled, even in Congress just across the way. But what was that like for you?
I was greatly interested in the opportunity to make a contribution. I thought, well, here we are. This is the biggest thing we've ever faced in medicine, a pandemic, a real live kind of medical crisis. And there were two bad outcomes, hospitalization and death. None of us wanted to be hospitalized, and certainly none of us wanted to die with this illness. So, I embarked with a great group of colleagues. We had doctors at Emory University and UCLA, and I was at Baylor at the time, to come up with a protocol, an approach that a high-risk patient could do at home to avoid hospitalization and death. And so it seemed to me that was the most natural, intuitive thing to do. This is 2020. This is before the vaccines. And what was shocking to me is that no institution grabbed the gold. And when I went on Tucker Carlson's show, I said, Tucker, Harvard doesn't have a protocol, and neither does Mayo Clinic. I mean, what happened to our blue ribbon institutions in the biggest crisis that they faced? They literally didn't show up, and everyone waited for a government protocol. Mm-hmm. And so when I went on Joe Rogan, and Joe reached out to me, I wasn't a follower of Joe Rogan. I kind of felt like maybe I wasn't in the age group that follows Joe Rogan. I said, Joe, I'm busy. I'm a doctor. I can't make it down, anytime soon. He was a little bit upset that I think when he calls, people show up. And I went down there just like this. I wore kind of a sport coat and a tie, what have you. And I said, Joe, I'm a medical doctor. I don't smoke dope. I don't drink alcohol. I don't have any tattoos on my body. I said, I really want a clean interview. I think this is going to be terribly important. I opened up my computer. We cleared off all the paraphernalia off his table, and we sat down, and point by point, I was very careful. And let me say a few things about Joe Rogan. He's very smart. Mm-hmm. He's very well prepared. And he has a way of asking a question where he truly wants to know the answer. And that's actually a real skill set. And the other thing, because of the luxury of time, he never interrupts. Now, I go on Fox News and a lot of major stations, and let me tell you what, sometimes the segments are 2.5 minutes or the most I've ever had is 7.5 minutes. And almost always you get interrupt. And any type of Senate testimony, I've testified multiple times now in the Senate and in the House, there's an immediate interruption. If you ever seen on Capitol Hill, it's like you cannot get a word out. Joe never interrupts. And a transcript is developed from this. And the transcript, because Joe had just had COVID, he had received the protocol I developed, McCullough protocol. The most frequently used term in my Joe Rogan interview was actually monoclonal antibodies. But what did our adversaries publish is that Dr. McCullough was pushing unproven therapies like hydroxychloroquine, as if I had some reason to push a generic drug. So we realized this whole thing was getting distorted quickly, and Joe Rogan is credited in breaking through to the young people.
Right. You talk a lot about that in the book, specifically in regards to Big Pharma as well. We saw these ads being displayed before, after, videos being made of these segments across all TV, mainstream media, of course, during this time period. And, for me personally, I was a student athlete. I played beach volleyball at University of South Carolina in a different life. But at the time, I was being, we were told take the vaccine, and all of us are Division I athletes, healthy, young, able to recover from, something like COVID at the time. I personally did not take the vaccine, had to spit in tubes for over a year. But I think that just shows how much this vaccine was pushed on people at the time. Of course, the president sees this as one of his greatest accomplishments with Operation Warp Speed and things like that. But I was able to do a really good interview recently with Alex Clark. She's a contributor with Turning Point USA. And I asked her, what's one of the things you would like to see change under the new administration, and of course, Secretary Kennedy. And she says, I'm anxious for them to ban pharma ads off TV because that hasn't happened yet. There's a reason why during the pandemic, every broadcast was brought to you by Pfizer. And then you didn't get to hear any alternative options about the COVID vaccine or alternative methods or wellness or anything during that time. I think that a lot of Americans probably felt that way during that time. And I know that's something that you personally really strived to do, and you were advocating for, of course, going on Joe Rogan, who I really admire for his curiosity, and something that needs to continue at this time. But I guess one of the things that you consistently addressed in the book as well, like I said, why was that so important for you both to address in the book?
Well, I can tell you that in a time of a brand new problem, a coronavirus that was leading to complications we could never have anticipated, like blood clots. The COVID virus caused blood clots like we've never seen before, and death. That no one has the right answer. No one has agency over information, and therefore someone else is spreading misinformation. that we saw almost this immediate use of propaganda. It's a brand new problem. We should have had a ton of discussion on this. We should have had minimal, every month meetings, bringing in all the leaders out there in medicine. What are we seeing? What's working? What's not working? Instead, we saw a shutdown, a lockdown, no discussion. There was no town hall meetings. There was no all hands on deck review. When the vaccines rolled out, there was no safety review. That's unheard of. A brand new genetic vaccine of which there was very little information. It was 1 month of the primary series, 2 months of observation, and then released to the public. No information about where the vaccine went in the body, how the body would ever get rid of it. How do we manage this uncontrolled production of the dangerous spike protein that the vaccines produce? It left everybody just essentially in a situation where it was presented to us and we were to accept it like an article of faith.
Right. And you go extensively, I highly encourage everyone to read the book. You goes extensively into Moderna specifically throughout the book as well. And it's talked about continuously. I did want to kind of jump over to the idea of the autism epidemic really quick. Also discuss just a ton in the book. Let's talk about MMR vaccines. Can you kind of give a brief summary for the audience? I guess there's a lot of confusion, even just those like me who do not have children, have not had to face this themselves, about MMR vaccines and the risk association with autism in children.
If you were a young parent today, and this wasn't your area of interest, you would have to question, why is there hearing after hearing in Washington about childhood vaccines? Why is everybody talking about childhood vaccines? Just the fact that people are talking about them so much would make you wonder, is something up? Is there a problem that I should be aware of? And when we investigate in our book, we do land at a point in 1998 where a gastroenterological surgeon in the UK made the observation with parents observing children that receiving the MMR vaccine in some children, they became ill, had a fever, had some gastroenterological symptoms, even lymphoid hyperplasia of the lymph nodes around the intestines, and they developed autism. So he published this observation in Lancet, and it was a valid paper in Lancet for over a decade. But there was relentless pressure on Lancet to retract the paper. He was smeared. Ultimately, the other authors were smeared, and the paper was retracted under the auspices of conflict of interest, that he had a conflict of interest. The parents were interested in litigation, for instance. No one actually challenged the data, and he had made a seminal observation. In fact, Leo Kanner, who is a child psychiatrist in 1943, originally described autism. One of the 11 children he described developed autism after receiving a smallpox vaccine in the 1940s. So it's led now to a very, very intense set of investigations of, could the ever increasing childhood vaccine schedule going from, I think, 5 vaccines when I was a child and a rate of autism of 1 in 10,000 to now 72 doses of vaccines in a child. That's actually before COVID. And then a rate of autism of 1 in 31. Could the two be related in some way? Because the vaccines are given during a period of vulnerable neurologic development. And there's concordant other diseases, not just autism. Attention deficit hyperactivity disorder is now over 13% of the US population. Epilepsy is way up. Tics, motor disorders are way up. Food allergies are up. Asthma, allergic dermatitis, a whole bundle of illnesses that could be due to excessive immunologic stimulation of a child if they're co-administered this bundle of vaccines. So it's led to a question that's put out on the table, and this came up in the hearings in the last few days. Could this epidemic of childhood diseases, and autism is an epidemic, there's no doubt about it, Could it be related to excessive vaccination?
Right. And I know the Secretary Kennedy has started to look into this, and he hasn't really said the word vaccine yet, but looking at environmental factors that could be looking at it. Why do you believe it's taken so long for the federal government to be looking into the causes of autism when 1 in 31 children are being diagnosed with autism?
The CDC is tracking this. The CDC has an autism network, 16 centers. They're carefully identifying children with autism. They're reporting the skyrocketing rates of autism across the country. No investigation into what's causing it. No alarm by the CDC. CDC has 12,000 employees, a $10 billion budget. They don't treat anyone. They essentially generate recommendations and publish some research papers. You can imagine, we could run a whole health system with that manpower. No investigation into the cause and no alarm. In their most recent paper, their conclusion is, oh, well, we should just get ready for more special needs services. And recently, McCullough Foundation, we did a investigation of schools of public health. I graduated from the University of Michigan School of Public Health. Only 3% of schools of public health have any curriculum on the autism epidemic. 3%. So no one is looking. When I went to the School of Public Health at the University of Michigan, there was a giant area of inquiry on the HIV pandemic, a giant inquiry on the hazards of smoking. Schools of public health are supposed to investigate these secular trends in disease that rise to the point where we need to be concerned as a society. We should clearly be concerned about autism because at 3.2% of the population having autism, some states higher, like California, over 5%, 27% of those with autism, it's profound autism. Profound autism is defined as markedly reduced IQ, cannot communicate, cannot talk at all, repetitive head banging, injurious behavior, cannot use the bathroom independently. 24/7 needs now in greater than 1% of the California population, lifelong special needs. Though this is an existential crisis. Can you imagine that 1% is going to pull down another 2 to 5% just caring for them? So autism should be a Manhattan Project right now. We should have all hands on deck to find out what is behind this and what can we do to reverse course. At least do risk factors. We don't even need to, make declarations regarding the cause. I'm a cardiologist. We don't know the exact cause of coronary heart disease, but we acknowledge risk factors, including cholesterol and smoking and diabetes and hypertension. With autism, we should at least have conferences and efforts to investigate, risk factors. Let's get to the point where we understand risk factors of autism, because autism is linked to another very disturbing trend that we see in medicine today. And, that's the transgender crisis. Most of the children who ultimately get to the point where they want to change their genders, they have autism and they feel ostracized. They're suggestible. They're in an environment where they're hypersexualized in school with all kinds of visual materials and on cell phones. And they actually now, start this gender journey. And the gender journey, all the studies agree on this. It increases the burden of psychiatric care, doesn't make it better. It's sterilizing, disfiguring, and it increases mortality from all causes. That's the reason why it was banned in 25 states, including Texas. It's the reason why the Supreme Court upheld the Tennessee ban, and Trump came in and pulled the funding for transgender medicine for the youth. But it's an area where it should be obvious the medical community is on the wrong side of this argument.
Right. And we actually had an article come out today with the Daily Caller talking about the use of SSRIs and the possible, linkage between violence and, use of these drugs in ways. I'm glad you brought up the transgender issue, though, just due to the fact that what's happened in the past week, of course, and what we're seeing in the details coming from that horrible assassination of Charlie Kirk, of course. Can you, to further explain the neurodevelopment issues with autism to gender dysphoria a little bit more, and into kind of a double part question here with specifically the MMR vaccine, measles, mumps, rubella. It's a combination vaccine, and you talked about this earlier, overwhelms the child system. So kind of two-part question. Can you kind of tackle both those things?
Well, the vaccines all raise inflammatory factors by their design to stimulate the immunity. Well, a key family of inflammatory factors are called cytokines. Cytokines circulate in the blood very rapidly after vaccines, and they readily go into the brain. So that's one of the reasons why, a baby can develop a fever after a bundle of vaccines. That's due to cytokines. So we know for sure fever is regulated by the brain. So there have been vignettes now published. One in our book we summarize is by Dr. Poling, who's a former neurologist, academic faculty at Johns Hopkins. He summarizes his daughter, Hannah Poling. So at 19 months, she had missed some of her vaccines. She gets a bundle of vaccines, I think well over a dozen vaccines altogether. She gets sick afterwards, develops a rash, some GI symptoms, doesn't have a seizure, although sometimes a febrile seizure is reported. And then within a few months, she develops classic autism. And then there's an investigation. There's a query of whether or not she has some predisposition based on cellular function in the mitochondria. But the point is, the clinical vignettes from families are very clear. And in the package inserts for the vaccines, they almost all list side effects. Now, they don't say their side that leads to autism, but they use the word encephalitis. Encephalitis means inflammation of the brain. The MMR clearly has encephalitis in there. Well, I can tell you as a doctor, the pattern that we see with autism, ADHD, seizures, these tics, they are related and appear to be a post-encephalitic state. And an important paper by Nielsen and colleagues from Sweden showed that if a child, in these critical ages, 1, 2, 3, 4, in this age range, if they develop a febrile seizure, which typically occurs at a temperature over 104. By the way, 107 is usually death. So, 104 is pretty significant. They develop a fever after a bundle of vaccines. And to have a seizure, the chance of converting to a neuropsychiatric disorder is 40%. So, there is this linear relationship. And there's another illness that's related to this big bundle of vaccines, and that's sudden infant death syndrome. And so a recent randomized trial was done in the hospital. So they had children under observation. They were born prematurely. And the randomized trial said in one group, they're going to get the bundle of vaccines on schedule. The other group said, no, we're going to hold off until later on. Well, the group who got the bundle of vaccines in the hospital, the little premature babies had more apnea. They stopped breathing, as they reacted to the vaccines. And so the nurses had to shake them and get them to breathe. Well, what if that would have happened at home and the parents weren't there to observe? It would have led to a sudden infant death. So there's great investigation here on the Hill of, could the childhood vaccine schedule have gone too far? And in fact, today and tomorrow are the deliberation days for the adult, the Committee for Immunization Practices, ACIP.
Absolutely. And I did want to read another quote from, sorry, one second, my interview with Alex Clark as well. And I asked, what do mothers want off the table? What are you hearing from mothers specifically? And she told me they want MMR completely off the table. I know that's huge. I know glyphosate is huge. I think American moms would really like to see glyphosate completely banned from being able to be used in our food supply. Of course, MMR obviously stuck out to me and was discussed heavily within the book. I found it very fascinating personally. And going back to the linkage here, to me, I'm seeing a pattern with Big Pharma being involved here, specifically with the vaccines. The vaccine schedule has been upped drastically over the years, of course, and now we're seeing many of these individuals that have suffered these neurological possibly injuries from these vaccines, if that is true, basically leaning on these SSRIs, which extremely strong psychiatric drugs, I would say. I have friends that were 20 years old been put on SSRIs. What are you thinking with that linkage? And I guess, like I said, with the Charlie Kirk shooting, there's a lot of questions that I'm starting to pose on where we're going as a society and I guess the aspect with big pharma in general.
So much to unpack. First thing to point, everyone should be aware, 1986, the vaccine companies were basically relieved of any liability for their products. So when a company has product liability, that means they're legally responsible for the outcomes of their product. So, the car company, if a car blows up and, it's a product safety, there's recalls and the company is responsible. We have better drugs today because companies, are liable for the safety issue. We have much better blood thinners than we have now because companies refine them. And in our book, we quote Supreme Court Justice Sotomayor, who said, a consequence of removing the product liability for the manufacturers is they have no incentive to make safer products. And so that's one of the problems. Vaccines are $100 billion a year business, of which half of the revenue comes from the federal government. So if there's, for uninsured or insufficiently insured people, the government steps in and buys the vaccines. So this is now big business. It should be of interest to you that the diseases are the same all over the world, but the practices are much different. The MMR vaccine in Japan was always considered not a good idea to combine these. It could be too much of a risk of this encephalitis. So they give the vaccine separately. Another thing that moms want, I think, is they don't want to face vaccine requirements for school, for employment, for the military. This is a big thing. You recently heard Joe Ladapo, Surgeon General of Florida, said, we want to get rid of these requirements. And then immediately on the news, they marched up, well, this is gonna have all these diseases come swarming back. And we give an example in our book where in Sweden, they didn't have the pertussis vaccine for 17 years. It didn't swarm back. So, our sanitation and all of our standards of living have markedly changed. We don't face the same infectious disease risks that we used to. And things aren't going to, swarm back like this. But people want medical freedom. Medical freedom is hot. And Dr. Drew Pinsky tweeted out a good analysis. 88 countries have no vaccine requirements for children to attend school or go to the military or work. And so I think you're going to see these tensions play out. So, and believe it or not, some of the biggest adversaries for medical freedom are the doctors' societies. So the American Academy of Pediatrics, for instance, is suing Robert F. Kennedy and HHS. And Kennedy, did 2 clicks on the internet and found the sponsors of the American Academy of Pediatrics, and they include the vaccine companies.
Right. Well, and I was actually present at the hearing in the Senate, and I've never honestly seen so much hooting and hollering from both sides. Secretary Kennedy handled it very well, but it really opened my eyes. I've never seen that in a hearing, especially even from the Republican side, in my opinion. So I guess with Big Pharma, and I want to kind of wrap back around to Operation Warp Speed, because that was one of the main topics that was really targeted on Secretary Kennedy at the time. What is your analysis? I know President Trump, takes that as one of his bigger accomplishments from his first term. What could be done better, in your opinion? I know he was getting a lot of different opinions, criticism, people like Dr. Fauci, who not the biggest fan of, not a lot of people are personally. But what's the analysis going forward with this? How can the government be in connection with Big Pharma, and can the government even distribute vaccines in a way that's effective?
Well, Operation Warp Speed, don't forget, was not just about vaccines. So it involved in vitro diagnostics. It had this fast track capabilities to it. And actually, in terms of bringing products forward, was pretty good. I think, though, the heroes of Operation Warp Speed were the monoclonal antibodies. Remember, the monoclonal antibodies preceded the vaccine. So they were brought to market before vaccines. The first one was bamlanivimab. They were always safe and effective. I use them extensively in my practice. The sad part about this is that the distribution was never equitable. Despite buying a dose for every single American, our government agencies could not outfit the nursing homes with doses of this. Every patient who landed in the ER should have gotten a monoclonal antibody infusion. But yet we were told, well, it's not indicated to use in the hospital. It's listen, what does it matter? They're sick with COVID. let's give this safe and effective strategy. So it turns out only 15% of people sadly went to the hospital, got monoclonal antibodies, but when they did, they survived, including my patients. So Operation Warp Speed did some good things. I think the in vitro diagnostics, the testing came along quickly. That's private-public partnership. We should have established standards for testing so the PCR test didn't overdiagnose people. That was a mistake. We should have fronted treatment like the monoclonal antibodies. And then other drugs, we're using generic drugs off their original advertising label, which is perfectly appropriate. But what everybody, associates Operation Warp Speed was with the vaccines. And there we had brand new, largely genetic technology with insufficient understanding of where they go in the body, how long do they last, how can we control or not control production of the dangerous part of the virus called the spike protein. And my great concern, I published an op-ed in The Hill in August of 2020. I'm the only public figure actually in the whole world who questioned this big time in writing in an op-ed, and I titled it The Great Gamble of the COVID-19 Vaccine Development. It was a gamble with populations, and we have it in our book, an important quote from the New England Journal of Medicine editor, Eric Rubin. And this came up in the summer of 2021 when they were deliberating over the childhood vaccines. Now, Rubin, who was on the approval panels for Pfizer and Moderna, Rubin says, listen, we will never know if these are safe in children or not. We're just going to have to use it. We're going to have to just get it out there without knowing if it's safe or not. And we believe that's one of the most reckless statements in public health in history.
Right. I also wanted to talk to you about, the type of people that are kind of doing the research and coming out with these vaccines. You're a doctor, you deal personally with patients yourself, but a lot of these people are in labs, scientists that, make these vaccines in general. You talked about in the book, there's this archetypical scientist playing God. Can you talk a little bit more about that and what you mean a little bit more?
Archetype of a vaccinologist, someone who develops a vaccine. We go all the way back to 1721. It was Dr. Boylston in Boston and, a strong promoter, Cotton Mather. Cotton Mather is a Puritan minister, is very influential intellectual at the time. Cotton Mather describes variolation, this very first attempt at doing this. He describes it as a gift from God. So this is 1721. Now, this is a tremendous fear of infectious disease. People didn't even know it was an infectious disease or what caused it at that time. But early on, we noticed tremendous fear, population fear, bold claims and hubris made amongst those who were developing vaccines, money and power. And you mix those together, you can end up with what we have termed vaccine ideology that is now essentially like a religious belief where people believe that, listen, we have to do this. And vaccines aren't perfect, but in order for them to work, everyone must take them. And if some people are injured or sadly die due to a vaccine, they have to take it for the team. That's called vaccine ideology. We think that's the reason why there's no investigation into death after COVID-19 vaccination here in Washington. Hasn't been for 5 years. The FDA offering up 25 childhood cases, just the start. I personally just had a conversation with Jim O'Neill, the acting director of the CDC, and point blank told him, you have 19,460 Americans who have died after the COVID vaccine, reported to the CDC, like doctors like me. I did the write-up. I've already determined the vaccine is a cause of death. And it's an obvious vaccine cause of death, like heart damage or a blood clot. So he knows it. He kind of looked at me a little dazed, but I said, listen, you're late, but Americans deserve an answer here. We think this is grossly underreported, by the way. So if I don't have the vaccine card, the death certificates, all the data, a doctor reporting to this VAERS system is a very serious report. The first 3 pages are, who's the doctor? Where do you practice? What's all your contact information? And it says, listen, this is under the threat of perjury that you could actually, you get federal fines or imprisonment here if you falsify records or have a spurious reporting. It's a very serious report. Most doctors don't even report to VAERS. So what we've seen here on safety, I think, is just the tip of the iceberg.
Right. And I don't want to spoil the book here, but I know you guys made two policy recommendations at the very end of the book and stuck out to me. And you just talked about it, calling on the administration to remove COVID-19 mRNA vaccines from the market and re-acknowledging the vaccine adverse event reporting system bears, like you just talked about. You even noted that President Trump acknowledged that Dr. Fauci played a decisive role in concealing the truth and played a large part in developing the vaccine program known as Operation Warp Speed, specifically, obviously, now that we talked about the vaccine side of things, which President Trump still holds, kind of as, again, one of his greatest accomplishments from his term. What can you go a little further, I guess, with that recommendation, what that looks like, outlook on the future for it?
It is notable that we're at a point where essentially no one's taking any more COVID shots. People believe the pandemic is over with. The CDC is not even reporting to us who's taking COVID vaccines anymore. It looks like it's over with. Not a single country in the world has done a safety investigation of the vaccines by their government authorities. Not a single country in the world has opened the vials to inspect them for quality, purity, concentration of messenger RNA, and not a single country has removed them from the market. It's an interesting observation. You can't get the world to agree on anything. Why are they? You couldn't get Trump or Biden to agree on anything except the COVID vaccines. So it is a very interesting observation. I essentially think the vaccine crisis in terms of administration is over with. No one's taking these. Now, the big issue is how do we manage the side effects? How do we start to kind of let the country recover? There's been two things that have hurt us, the COVID-19 infection and the vaccines. And sadly, because the vaccines don't work, many people had both exposures to this very unusual protein, the spike protein, which was devised in the Chinese biosecurity lab.
Right. And the second recommendation that he made was about an exhaustive investigation, what is causing the autism epidemic, which Secretary Kennedy is now stating they are doing, which obviously is a positive step in the right direction, it seems. I'm going to actually go to the audience. Does anyone want to ask a question? And I think we're going to actually log off the broadcast, so we're going to take these questions off air.